ahead and get started. Welcome everybody to our subcommittee meeting regarding calls for service. Really good to see everybody virtually, and welcome to the new year on the board. So perhaps Sandra and I, we will start, we'll do some introductions, and all the board members and our subcommittee board members can introduce themselves as well before we move on to other business. Very briefly, for those of you who I have not yet met, and for those of you members of the public who are joining us today, I'm Angela Sierra. I'm an attorney with the California Department of Justice, and I am a RIPA board member. I am the Attorney General's designee on the board, and I've been with the board since its inception. Very happy to be here today with all of you. Thank you for joining us and helping us with this important work. And I am a co-chair of the subcommittee along with Sandra Brown. So I'll turn it over to Sandra for her introduction. Oh. Sandra, you are muted.
I got it. Thank you, Angela. Good afternoon, everybody. It seems like it's been a long time since we've gotten together. I mean, October 6th seems like a year ago. I am Sandra Brown, retired police lieutenant for the city of Palo Alto, 30 years in law enforcement. I joined the Department of Justice on a subcommittee back in 2017, and I became a RIPA board member in 2018. Been great working with everybody here, and I am also a Senate Pro Tem designee and a co-chair with Angela on the Calls for Service subcommittee. So thank you for being here, and I'm excited to go forward and see what we're going to get today.
Okay, then we'll have introductions from our other board members.
Good afternoon, everybody. I'm Felicia Espinosa. I am in the Central Valley Root and Rebound office. I am an attorney by trade, been an attorney for 11 or 12 years. Root and Rebound helps system impacted people in their road to reentry, regardless of where they are. So if they're freshly coming home, the ways that it impacts their lives decades later, and was appointed by the DOJ, by the Attorney General last year. Have been here since and have a couple of years more on my appointment. Grateful to be here with everybody. Thank you.
Thank you. Let's see.
I guess I'll go next, I guess. My name's Edgar Hampton. I'm with the current president of the Anaheim Police Association. In addition to that, I'm the president and director of the Orange County chapter of PORAC. And in addition to that, I am also one of the board of directors for PORAC, and I represent the 66,000 officers, members of PORAC.
Right. Thank you. How about Sheriff McMahon?
Well, good afternoon. John McMahon, the Sheriff of San Bernardino County, but representing California State Sheriffs Association and 58 elected sheriffs.
Great. Then we have Professor Raphael.
Hey everyone, I'm Steve Raphael. I'm a professor of public policy at UC Berkeley. I've been on the RIPA board for a couple of years now, and I'm the gubernatorial appointee.
Do we have any other board members joining us this afternoon? Okay, terrific. Well, thank you again all for being here. So looking at our agenda, our next item is with respect to the minutes from our October 6th meeting. So I'm going to make a motion for us to approve those minutes. See if we have a second.
I'll second it.
Great. Okay, so all in favor, say aye.
Aye.
Aye. Great. And anybody opposed? Okay, so the motion is approved. And I'm hearing feedback, so I apologize about that. So next we have, we're going to have an overview by staff at the Department of Justice. So Anna, should I turn it over to you or Kendall?
Hi, good afternoon. It's great to see some of you for the first time this year and to welcome new board members to the subcommittee. I'm going to share my screen just briefly. I'm not going to do a long overview today, but I do want to, can everyone see my screen? Okay, so before we get started with the presentations, I wanted to give the board just kind of a brief overview of our vision for future reports and where we left this subcommittee after last year's report. So the calls for service section as of right now addresses kind of two core components. One of those is bias by proxy, and the other is focused on crisis response. So last year in our vision for future reports, we left a few kind of goals for this year. So I figured this would be a great way to get us started and started on our work in this subcommittee. So on bias by proxy, some of the things we had discussed was analyzing best practices and policies regarding bias by proxy, exploring both evidence-based best practices as well as individual agency policies. So one thing we could do, for example, is do another review of policies to see if agencies may have updated them to include bias by proxy. Any developing model policies and trainings for dispatchers regarding bias-based calls. And we had discussed reviewing restorative justice approaches to bias-based calls. Similarly with crisis response, one of our goals or our visions was to invite leaders from some of these organizations we wrote about last year to come and speak to the board. And we're very fortunate to have folks from San Francisco, both from the Department of Emergency Management, from the Fire Department, and from the Department of Public Health to discuss how these crisis response teams and community-based response teams are being implemented. We also discussed as our goals for this year, reviewing crisis response models and starting to look at data on the how effective certain practices may be. And then making recommendations to improve crisis intervention in California. So starting to develop or review evidence-based practices or core principles to crisis response. So I'm going to go ahead and stop sharing my screen. I'll, at the beginning of the board discussion, I'll give a few kind of brainstorm topics for folks to think about. But we have some amazing presenters here today, and so I want to make sure the board has enough time to hear from them and to learn. So I will do some brief introductions, and I can share my screen for the presentation for the folks in San Francisco if that works as well. So the folks who will be presenting to us, Angelica, and I'm so horrible with pronouncing names. That's why I was given the last name of Mickelplate. Angelica Almeida, she is the Director of Forensic and Justice involved Behavioral Health Services with the San Francisco Fire Department.
Let's see if anybody's close. Okay. And I tried.
Simon Pang is also here. He's the Chief of Community Paramedicine in the San Francisco Fire Department. And I'm not sure if Robert Smuts is on the line. He is the Director of Emergency Communications with the San Francisco Department of Emergency Management. Yes. And so with that, I'm going to turn it over to our presenters to speak with the board. Hi, Angelica.
Rob, you're going first, right?
I'm sorry, Angelica. No, why don't you go first? I think.
Okay. Okay, great. Let me see if I can share my screen. Is everyone able to see my screen okay?
Yes, that looks good.
Okay, perfect, great. So again, I'm Angelica Almeida. Kendall, you did a great job with my name. Don't worry about that. I'm with the Department of Public Health and Behavioral Health Services in San Francisco. And again, Kendall already mentioned Section Chief Simon Payne. So Simon, please feel free to jump in. I'll try not to take too much time, but just to give an overview of our program. So we recently launched a street crisis response team program in San Francisco. And so I could talk a little bit about how we got to implementation of the program, some of our early lessons learned, and where we're heading. I'll skip over the outline and just jump into it. But just to highlight that us launching our street crisis response team is really part of our overall commitment to reform. This includes specific legislation in San Francisco called Mental Health San Francisco legislation, which is really looking at opportunities to enhance our behavioral health system with a particular focus of supporting individuals who have had contact with the criminal justice system and or experiencing homelessness. But as we know that there have been many challenges and calls for police reform across the nation. And so there was a commitment by our mayor around police reform, and in particular to have alternatives to policing for calls that are nonviolent incidents, and particularly when there's a behavioral health need for those individuals. This has led to a couple of different conversations in San Francisco to think about the best way to do this. The street crisis response team being one of those interventions, but we're also looking at this across a number of different call types, and I'm sure Rob will speak to that a little bit more. But we have two processes through our Human Rights Commission and also our Coalition on Homelessness, again, to identify what are potential calls that could be diverted to other programs or team members rather than the police department. We also spent a lot of time in preparation of launching our program to speak to other jurisdictions who have implemented similar programs. I'm sure people have heard of this, but one of the primary programs we hear about, and certainly we consulted with in San Francisco, is the Cahoots model out of Eugene, Oregon. But there's a number of other programs across the nation and local to the Bay Area that we also spoke to while we were designing our program. As we're thinking about launching our program, one of the things that we really focused on is this model from SAMHSA, this idea that there needs to be someone to call, and we are operating this through 911, again, as a way to divert calls that have been going to 911, but to have an alternative to that. There needs to be someone to respond, so really focusing on that area, which is our street crisis response team. And people also need somewhere to go. And this is part of our overall enhancement as a system, but I think it's really important. We can't just have somebody to respond to crises, but we need to have alternatives for individuals to support them. And that there truly needs to be no wrong door into treatment. I think that's something a lot of our systems talk about. And, you know, I often say that services can be a little bit like the Winchester Mystery House, where we say there's no wrong door. But for those of you who are familiar with that reference, there's stairs that go up to ceilings or doors that open to walls. And we truly need to have a system that's welcoming, trauma informed, and able to, in a competent way, accept people into those services. And equally important and related to that is that we need to have somebody to support individuals in that immediate moment of crisis, but we also need to support individuals and bridge them into ongoing services so that we can mitigate any future crisis. So while we were primarily focusing on the summon to response section, we were also thinking about this overall continuum. So our goal for this project, and I know from many projects in other jurisdictions, was to provide rapid trauma-informed response for individuals experiencing a behavioral health crisis, and primarily in a public space. And that this would ultimately reduce any unnecessary contacts with law enforcement, the criminal justice system, and any unnecessary emergency room use. As I've already said, you know, there's a lot of conversation about the best way to do this. If you have a separate phone number to call, or if you utilize 911, we decided, at least for our initial stages of this program, that we would focus on 911. And again, we know the volume of calls that are going through 911 that we believe could be diverted, and I'll delve into that a little bit more, that could have an alternative to police response. And we wanted to primarily focus on those before we thought about another number to call. But I will say this is a really important thing for all jurisdictions to consider, because there are certainly communities that feel more comfortable calling 911. And we've certainly talked about this in San Francisco, that there are communities, because of institutional mistrust, racism, are less comfortable calling 911 because of a concern of having a police response. And so that's something really to think about in terms of the population that's being served. And if you go with 911, how to mitigate that and how to build those relationships with communities, particularly communities of color. Of course, our team is really designed to provide therapeutic de-escalation to support individuals. We have some details here, but I'll talk a little bit more about our team makeup on the next slide and why we decided to go with that. And again, part of what we developed in response to this program is also some dedicated capacity to support that follow-up, to bridge and link people to ongoing services, which is something we'll be tracking very closely. And I'll talk about our evaluation portion of this project as well. So I'll say we're pretty new to this work. It was a pretty aggressive timeline that we had for implementing this program. And we launched our first team November 30th. Which focused on a relatively small geographic area in San Francisco, but one that relative to the size has a very high volume of calls. We then launched a second team, again, in a smaller area in San Francisco, but also the high volume of calls February 1st. And in total, we're going to be launching 6 teams. So we have still 4 more teams to launch, and that will allow us to have opportunities to respond to these calls in San Francisco and to provide citywide coverage with the goal of providing that coverage 24 hours a day, 7 days a week. This is just a brief overview of our budget, but just to highlight the project costs and some of the requirements and things to think of in terms of training, staffing, that follow-up support and care coordination, and of course evaluation. And we want to make sure that the work that we're doing is effective. But let me delve into the meat of it in terms of the program details. So each team for the Street Crisis Response Team in San Francisco includes an emergency services vehicle, which is through the fire department. And this team, of course, is transporting the staff to the scenes where they're responding, but it also allows us the flexibility of if somebody is willing to go to another location on a voluntary basis, that this team is able to transport them, that we don't need another service to do that, but the team that's been able to de-escalate an individual, stabilize them, and provide that support and has that relationship with them is able to then support them to their next location. So each team includes 3 team members. There's a community paramedic through the fire department. And Simon, do you want to talk a little bit more about what a community paramedic is?
Yes, a community paramedic is a traditional paramedic that typically responds to 911 emergencies and is authorized to work on the scene of an emergency and in an ambulance en route to an emergency room. Community paramedicine has been a pilot in the state of California for the last 5 years. It has now been passed into law to formalize that in California. And community paramedics have extra training, an expanded role into non-emergency settings. In San Francisco, the community paramedic missions are frequent 911 utilizer and alternative destination. We have a lot of, in San Francisco, we're focused on most of our frequent 911 users are experiencing homelessness and have dual diagnosis. So this is something that really complements our existing program.
Thanks, Simon. So again, there's a community paramedic on the rig. We also have a behavioral health clinician. And something that's unique to San Francisco is we include a peer specialist or somebody with lived experience. So there's 3 team members on each rig. I'll just highlight, we have the community-based organizations that we're partnering with for the clinician and the peer specialist. But just to highlight a couple of quick things, that we decided to go with community-based organizations for these providers because, again, as alternatives to policing, we wanted to make sure that these teams were very much rooted in the community and part of the fabric of the community, which is part of our goal for that. And again, part of our goal of including somebody with lived experience is having somebody on the team who has that experience that somebody has been in and is able to share that with an individual. I'll just say this also can come with complications around training, team dynamics. We've invested a lot around training for the team and supporting the team. So it's something that's really important to take into account when developing these programs. But we're already seeing huge success with this team makeup, and we're very excited about it. Just to highlight a couple of quick things again, and having this dynamic team, sorry, my 2-year-old is going to sing to all of you. But having this dynamic team allows us to really support the whole person in a holistic way. So some examples about how this has come across in our early implementation is for the community paramedic, checking basic vitals. There was an individual who had unknown high blood pressure who needed medical intervention and was able to be transported to the hospital. For the behavioral health clinician, of course, having that specific lens for individuals who have complex trauma. There was somebody that they worked with who had recently been the victim of a rape and was able to support them and have that relationship with them. For the peer specialist, we had an individual who had negative experiences and traumatic experiences with the medical system and was very fearful about the clinician and somebody in a more formal role of the clinician and the community paramedic. And it was really the peer who was able to support them. It was somebody who the team had gotten multiple calls about, who had been running around the community naked, and was able to have a conversation with them, develop that relationship, and support them in putting on clothes that the team had on the rig. And so we're seeing this come across. It gives the individual that we're serving an opportunity to identify who they feel most comfortable working with in that moment. And so it provides us and affords us with a lot of flexibility to meet the needs of that person. And again, we're seeing really positive outcomes related to this, having this dynamic team approach. I also mentioned the other piece is having dedicated capacity to provide that follow-up care. And this is something that we're working on operationalizing now, but we're very excited about being able to provide case management, linkage support. So immediately meeting the needs of the individual, but also in this whatever it takes, wherever it takes approach of meeting people in the community where they feel most comfortable after that immediate crisis has resolved, to support them and bridge them into services. I talked a little bit about our teams and coverage. I won't delve into this, but again, we do have a goal of 24-hour coverage, 7 days a week, but each team represents 7-day-a-week coverage for 12-hour shifts. And so again, we'll have 6 of those teams operational. We are working very diligently in terms of community engagement, but also looking at volume of calls, of how we're able to promote equity, develop those relationships in the community and those relationships with community members. I will say another piece that's been really important is identifying what types of calls we want to be able to respond to. And I'll pause for a second before I move to the next slide. And I'm sure, again, Rob will speak a little bit more to this, and in terms of the dispatch piece, and this is something that we spent a lot of time discussing, but we really wanted in San Francisco to focus on calls, again, that had a specific behavioral health need. And in San Francisco, we identified those calls to be, there are 800 calls, which are, and again, I'll say this is not particularly trauma-informed language and older language, but individuals where calls are identified as a mentally disturbed person. And so those are the calls that this team is focusing on now, but I recognize for each jurisdiction that might look a little bit different. We know that there's a high volume of well-being checks, et cetera, and so that's an important thing to consider in terms of the makeup and who's responding to each call and the best way to do that. Our primary focus right now is to be able to divert all of those mentally disturbed person calls to this team and to provide that citywide coverage in this pilot period, so we can see what a potential expansion might look like for this team. So again, we're learning a lot in this process, and we're learning with all of you as well in similar jurisdictions, and we're pretty excited about it, but also new to this work. I'll just say briefly again, our calls are coming through 911 dispatch, and for individuals who there's not current violence or a weapon involved, and we're primarily focusing currently on calls that are happening in public spaces as our most immediate charge for this team, although looking at expanding that as we become more fully operational. You'll see on the right-hand side of the screen that this is really the workflow for the street crisis response team in terms of receiving calls and resolving in the community or transporting individuals to another location. And again, in all situations, having that follow-up support. I do want to highlight something that's also important in terms of expectations from the community and for having these discussions is what a positive outcome looks like, because I think that different stakeholders might feel differently around this. But what most other jurisdictions have seen is that roughly 71% of calls resolve in the community, or an individual stays where they are, they're able to be de-escalated, able to be supported. We're seeing similar data now for our program, but that's something that I think is important in terms of setting expectations for what this team is and isn't able to do. The other thing that I think is important work for our team is, again, being part of the community and the fabric, is that they're driving around. We certainly are responding to calls from dispatch from 911, but they are also supporting individuals who they see in active distress or what are considered on views. So they're supporting individuals that they are seeing in distress, not waiting for a 911 call to happen. So that's also part of the work. We've also, as part of that, been able to support overdose individuals who are overdosing and to reverse those overdoses. We've also recently started, as I'm sure many other jurisdictions are also seeing, the high rates of overdose deaths. The team is also carrying Narcan that they're able to distribute to individuals in need. So again, really looking at how we can holistically support our communities. Talked a little bit about how we got to responding to the 800 codes, the mentally disturbed person codes. This gives a little bit more information. I will highlight that we looked at this from calendar year 2019, so this is pre-COVID data. Of course, we know that 2020 brought a lot of changes and things look very differently in light of the pandemic. But this is the data that we looked on in making some of these early decisions for implementation. Just to highlight some other code types that we also saw that had a behavioral health need that we're not currently responding to, but were part of the conversation, are the persons attempting suicide and the well-being checks that I mentioned. So that's some of our ongoing conversations in terms of alternatives to policing, whether it's specific to the street crisis response team or other proposals that exist in San Francisco. But again, something that's important to think about in terms of the scope of the work. Okay. I will briefly touch on this. I won't go through this, and Kendall, please feel free to share these slides, but I'll just highlight that we, knowing that in terms of this work and this being an alternative to policing, the importance and value of community engagement, and that's being something that's an ongoing process throughout this work, but that includes talking to providers, other city agencies, other jurisdictions, as I previously mentioned. But the other piece that I want to highlight that was incredibly invaluable and really encourage other jurisdictions to consider is we did a number of focus groups with consumers to understand, for people who have gone through a behavioral health crisis, what would be helpful for them, what would have been helpful for them at that moment, what their thoughts are, and down to details of like, what should the vehicle look like, what kinds of engagement supplies like food, like should the team carry with them, what should the team wear? So, not just the makeup of the team, but also the details of what those interactions on the ground look like. And I think that that was incredibly invaluable to have that insight as we were implementing the program. And again, just to say that community engagement is certainly a journey. It is not a destination. It's something that we look forward to continuing throughout our process, including a meeting that we have tomorrow. But just some highlights in terms of our objectives for community engagements and things for individuals to consider is there's certainly the public awareness of what this team is, what the scope is, what we're able to do and what we're not able to do. And that certainly relates to managing expectations for the community. And building trust. And one of the things I know that I mentioned previously in terms of individuals calling 911 to be able to access this team, we know that that'll take some time. We may certainly need to look at alternatives for communities with that mistrust to be able to contact this team. The other thing that we also know and is important to be thoughtful of is when we looked at the data for where we had these 800 or mentally disturbed person calls, we looked at them in terms of geographic areas to think about where we wanted to implement first, knowing that we were going to be scaling this up. But we know that there are some areas of San Francisco, or we hypothesize that there are some areas who, in terms of data, have a relatively low volume of calls, but we know that that doesn't necessarily mean that there's less need in those communities. And so when thinking about that, it's just important to have that equity lens to look at how you best engage those communities. We're certainly going through that now, and how we engage those communities, how we move forward, and knowing that some of that work might be less around dispatch and more around on views or community members flagging that somebody is in need. And so having that flexibility, and we know that this is going to be an iterative process for us. This, of course, certainly looks at addressing institutional racism, and something that, as an alternative to policing option, is something that's important. The other piece that we want to highlight is that for every call that SCRT, because we're responding to 911 calls, for every call that SCRT responds to, that is a call that is being diverted from the police department. And I'll say in our first 2 months of operation, where we only had one team operational, we were able to respond and divert 20% of those calls away from the police department. Our goal, of course, is to divert 100% of those calls away from the police department. But again, we're already seeing that a high volume of those calls have been able to go to the street crisis response team. And so not just in terms of the response, but also looking at the outcomes for individuals. And I strongly encourage jurisdictions who are doing this or considering this to include funding for evaluation, because I think that that's incredibly important, because we want to make sure the work that we're doing is effective, but also to drill down into looking at health disparities and outcomes for individuals and how successful we are in linking individuals, and really addressing some of those institutional racism that we see in all of our systems. And again, I mentioned in terms of building those relationships and other alternatives to deploying the team. I know I've talked a lot about the pilot evaluation. I'll say that we have 2 evaluations that we're doing for this project. We have contracted with a company called Harder & Company to address some key questions for us in terms of the effectiveness of the team, who are serving, those demographics that we talked about, and successes and challenges. But we are also very fortunate to have a research grant through the Robert Wood Johnson Foundation that is also looking at linkage to services, reutilization of crisis services, and housing placement. We know that individuals that we're serving through this project are disproportionately experiencing homelessness. About 96% of the cases that we've seen thus far have had housing instability. And so that's something that is incredibly important for us to look at in terms of outcomes. And overall, while we're, again, very excited about the project that we've designed, we know that this is a continuous process improvement plan where we're able to have opportunities to reflect on data and not be reactive to data that we're seeing, particularly being early on in our project, but to be able to reflect on that and to make thoughtful and data-driven intentional changes to our program so that we're better meeting the needs of the community. So I'm going to stop here. I know that was a lot of information really quickly, because I want to make sure that Rob has plenty of time as well. And Simon, I'll just say briefly, we have a couple of client impact statements here that could be shared in the presentation. I won't go over them, but I'm going to stop sharing my screen for a second. Simon, I don't know if there's anything you'd like to add, or if we just wanted to see if people have questions for us.
I have nothing to add. Thank you, Angelica, for that overview, but I'm certainly happy to help answer your question.
Sounds like an amazing program. I wanted to just ask a quick question about the 800 calls you're getting, and just a 2-part. So how many, if you had some ballpark, I imagine that some fraction of those are multiple calls involving the same individual over time. And I wonder if you're seeing that maybe having that kind of nimble response, if it's maybe reducing the volume over time. And then a second question, I was wondering if you were to think about the issues that come up the most that are barriers to helping people, whether it's, people don't want to leave their pets or other things that come up. Are there some lessons early that you've learned in terms of connecting people to services?
Really appreciate that. So I'll say in terms of people having repeat calls about individuals, Rob and Simon, please feel free to jump in. I would say I think that's hard for us to know currently because it's based off, like, we know 911 call volume, but that we don't necessarily know if it's the same person. And so that'll be something we'll learn over the course of this project. We're tracking people in our electronic health record. And so if the street crisis response team has had multiple engagements with an individual, we'll be able to identify that. I think it's hard for us to know otherwise, but Rob or Simon, is there anything you'd want to add to that?
This is information that we can clearly determine. At the moment, we're getting this program stood up in light speed time, and we have multiple sources of truth that we're trying to distill into one, into one analyzable, data source. We do have another community paramedic program that the fire department has, works with frequent 911 users. So whenever we come upon an individual to the street crisis response team, we are able to, in the moment, know whether they've had contact with the emergency services system. So that is definitely information we can find out. And we're interested in knowing that. So we will do that. What was your second question?
Well, I guess the second question was concerning any frequent barriers that you encounter in terms of connecting to those services that you've learned early on.
Well, I'd say, first of all, it turns out that a great number of these calls are third-party, originate from third-party callers, people who are no longer on scene. So that could be a barrier because we get there, and most of the time these calls are either unable to locate or the person has gone on our arrival. When we do engage them, this is unless someone meets criteria for an involuntary mental health hold, it is voluntary. So we can make it as attractive as possible to go to shelter or a shelter-in-place hotel or to go to a program. But ultimately, it's the person's choice. And like Angelica mentioned, that doesn't mean that we haven't successfully mitigated the crisis that we were called there for, but we may not be mitigating the crisis of experiencing homelessness. But maybe the fact that they were shouting on the street corner or poorly clothed, maybe we've mitigated that, but they're still remaining in the community.
Angela, if you don't mind, I have a couple of questions. So first of all, wow. If we had this 30, 40 years ago, I think we would be so far into the program that it would become very familiar with everybody. So my question is, do you have direct access to the 911 via radio in case you need help from the police? Are you on the dispatch with police?
That is, yes.
Okay, good. And then out of all the calls that you've experienced so far, have police had to intervene for the safety of the team? Just curious. No.
For the safety of the team, no. But, we do work, 911 first responders work closely with law enforcement for various reasons, but we have had no situations so far that we, asked for code 3 police response because we were not in a safe situation.
That's very impressive. And then funding, that's a lot of money. And I'm curious, where are you getting your funding? Because I can see that if the funding lapses, the program goes, obviously. That's very interesting. And then is that donation based or is that general fund based? You have a lot of people to pay and training, and I'm just curious where your funding's coming from.
I think we're very lucky right now in San Francisco that we have a lot of investments being made into behavioral health. So we have that commitment. We have, through the Mental Health San Francisco legislation that I mentioned, and also Prop C in terms, we've just had opportunities to add additional resources into our system, and this being a priority, certainly for individuals in crisis, but also as an alternative to policing. So I think we're lucky to be implementing during this time, but we do recognize it is an expensive alternative. And so one of the things that I know people will be looking at is our outcomes and the effectiveness of this program.
Well, for all three of you, and I know Rob hasn't spoken yet, I'm impressed. I remember starting in the early 80s in policing, and we didn't really have a lot of homelessness or mental health issues. And then obviously after, I think it was Reagan, all of a sudden we started seeing it. And we were seeing repeat calls, the same people all the time, and physical altercations and drug addiction and alcohol problems and nowhere to take people. So your presentation was, for me, very awesome and eye-opening, and I hope that this spreads across the country because it's necessary. Because personally, I lost my sister's husband was injured and lost his life as a mental health consumer, but unfortunately, we didn't have this program, and he died of positional asphyxiation. By the hands of law enforcement, which I was in, but it's nice. It's about time that we have that opportunity to use you. It's been a long time coming, so thank you very much. Awesome presentation.
Angelica, I have a question, and I agree. Thank you so much. This is really amazing, and it's going to be fascinating and so helpful for other jurisdictions to be able to learn from this. So it's really incredible. And, and in thinking about other jurisdictions who may want to replicate this type of program, a question that comes to mind is, right now I understand that you're focusing on crisis and people that are in public spaces. So I'm assuming that means like if there's like a crisis with a family member in someone's home, this program would not be a program that would respond to it at this time. Or am I misunderstanding that? And then the second question is, I was curious about, making the decision about should it focus on public spaces versus what I just described. And do you think the model would have to be very different if you shifted away from public spaces? And is it more of a kind of a jurisdiction by jurisdiction kind of decision given what the needs are of the jurisdiction?
Yeah, I'll say some of this was legislative in our mental health San Francisco legislation to focus on public spaces, which is where we started, of course, but really looking at expanding to be, any of these mentally disturbed person calls, regardless of location, to be able to respond and divert all of those from law enforcement. We also have in San Francisco, we're fortunate enough to have a comprehensive crisis services program who does a lot of response to homes. And so this was certainly not meant to replace that. They don't take calls directly from dispatch. So there's some differences. But I'll just say we're lucky to have a more comprehensive system that I recognize maybe some other locations do. But that's something that we're hoping to move towards, to be able to respond to any of those mentally disturbed person calls regardless of location. We're just not quite there yet.
Great. Thank you.
This is Edgar Hampton. I have a quick question. We just started our crisis team here in Anaheim as of January 1st. One of the questions I have is, how are you guys able to track how many calls for service, what the calls for service are? Are you guys part of the CAD system that in San Francisco, meaning the dispatch, as far as the incident number and everything else like that? Or do you guys have your own system to track how many calls for service, the location and everything else like that?
That's Rob Smuts all over. Yeah, that's a Rob Smuts question there.
I think the answer is both. They are in the CAD. We dispatch the street crisis response team over fire department radio channels, and we track them in our CAD. San Francisco has a unified PSAP. We do police, fire, medical, and sheriff from the same PSAP. I know they also have other systems that they track information in, but they are all in CAD. Yes.
Thank you.
Just one more question. How do the dispatchers triage these calls? Do they have a checklist that they go through and then it decides whether it's going to go to the crisis team versus the police?
Yeah. Perhaps I don't have a formal presentation, but perhaps I could speak a little bit. I don't know if the appropriate time for me to do that, and certainly answer that question as part of it. So I thought I would speak briefly, talk a little bit about how dispatch interacts with SCRT, but also zoom out a little bit to talk a little bit about broader context. And as I just mentioned, in San Francisco, we have a unified PSAP, so we dispatch for all the public safety entities. We dispatch about 570,000 incidents a year. That's not counting on-views where police come across something going on. About 415,000 of those are police, 125,000 EMS, and 32,000 fire. And there are several efforts underway to look at whether those 450,000 police incidents should all appropriately stay with the police, or whether there are alternatives that might be more effective, efficient, or better in other ways. SCRT is probably the furthest along of those efforts. And just numbers, the codes that were in the incidents that we're in the process of diverting into SCRT as SCRT scales up is about 10,000 a year. So about 2.5% of total police calls. And some of the things that I pay a lot of attention to when in my role in working on these initiatives is how do we make sure that any change we make does not diminish service, so does not result in longer times to get to an incident or other negative outcomes. How do we get from point A to point B, and during the transition, and then also how these efforts, as we have more of them, knit together into sort of like a continuum of efforts. So you asked how dispatchers triage these calls and make the determination. So we started by just taking an existing police code and turning it from just police response to actually creating a joint response. We send up simultaneously a police response and the incident for SCRT, whichever unit gets dispatched first, then we cancel the other one. And that's the going from point A to point B. As SCRT scales up and has the full staffing, we will remove the police codes, and actually, as necessary, EMS will backstop SCRT. One of the considerations in any of these programs is you may know how many incidents you have during a year and how many on average you have at any given time, but incidents don't happen on average. They happen in spikes and troughs. And so you always need to make sure that you're thinking about how you backstop an effort. Police departments and fire responses are large staffed agencies that can accommodate those spikes and troughs. If you have a more focused initiative, you can get overwhelmed by them. So we're going to move from having police be the backstop, which they currently are to these calls, to having EMS be the backstop. Talk about a few other things that we're looking at. We're looking at other calls that SCRT might take on in future phases. Most agencies have some variant of a well-being check call, and well-being check calls are always, they're one of the calls that most greatly concern me, because in most cases they're nothing, but in some small fraction of cases they are something very serious. We have about 26,000 of them a year, some of which would not be appropriate for SCRT. We dispatch to an open line call or to somebody who has been unable to reach their elderly relative in a few days or something to that effect. But a large portion of them here in San Francisco are in a public setting, somebody who might be sleeping or might be having some other issue. And we're talking about how to have better responses to that, whether it's SCRT involved or some other alternative. We're looking at that. I wanted to briefly share my screen if I could here. Can people see my screen now?
Yes.
Yes. Okay. Just talking a little bit about alternatives to policing. What I'm showing here is in San Francisco, we have 3 priorities for police calls, A, B, and C. A is the highest acuity. That's basically, well, not always lights and sirens, but immediate response. B is sort of intermediate level response, and C are lower priority, can take an hour or more to get to report calls. And I broke out into some categories here. Going on to the next one, SCRT has focused on starting off what I did with the green circle, which is mental behavioral health related calls. And 910 is our code for well-being checks, potentially a future area of focus. Looking at higher acuity, SCRT does not respond to mental behavioral health calls or other issues where there is an immediate threat to life or safety. But that's something that we are always interested in looking at our response and figuring out if we can have more effective response to those calls. In those, the challenge is making sure that we don't take longer responding to them, obviously, because they've been determined to be an immediate threat to life or safety. And then there's the C priority calls. And in San Francisco, a very large portion of those are related in some way to homelessness. And Angelica mentioned some of the other cities that we looked at when looking at SCRT. And a lot of what those other agencies do actually are focus on lower acuity calls than what SCRT is focused on. They are, if you look at Cahoots in Eugene, Oregon, or some of these other models, a lot of them are responding to the lowest priority calls that oftentimes are related to homelessness. And there's an effort in San Francisco to think about what we might be able to do besides a law enforcement response to those calls. Figure out how to stop sharing here. I wanted to mention those things. As I said, I didn't have a formal presentation, but I wanted to offer those into the conversation and also be available for any questions.
Angela? Okay, so Rob, awesome. I'm real positive today. I want to stick to it. Okay. I know that Angela was going to put up 2 conversations, I think, with community members. And we didn't get an opportunity to see that, but have you yet discovered what the community response is for those folks that are in need? What are they saying with this new way of responding to their needs with health and not police? Have we heard anything? I mean, I know it's still fresh, October, but what have we heard so far? And then the marketing of it. When you talked about the vehicle and the uniforms and all that, is your program becoming more recognized as we go, even though it's been less than 6 months, October, November, December, January, going on to 6 months? Do they recognize it? And is there do you feel like people are like, okay, it's not the police, it's the SCRT?
I think Angelica could probably speak to that mainly, but I do want to add something from a 911 perspective. We are getting calls for people who are specifically requesting the street crisis response team, who've read about it in the paper, heard about it in the local news, and sometimes it's appropriate, sometimes it in this intermediate phasing up stage, it hasn't been appropriate. But I do think that it does also, I think there's probably some latent demand out there that has not been using 911 because of distrust or other barriers. And I think that we might be seeing the tip of the iceberg of that as well. But I'll turn it over to Angelica to answer that in more detail.
Yeah, I agree. And again, we're still very new in the program. So, and we've had very specific geographic focus for our teams that have launched thus far. But I do think, they are in the community, they are driving around. So primarily responding to dispatches, but trying to build those relationships in the community. So I think that there has been that relationship building for those immediate communities. That is something that I think is going to be an ongoing need, particularly as we're expanding our work and geographically in both as well as scope. Will take some time. I do think people recognize it. It is an emergency well, I guess you're better positioned to speak to this, but it is a fire department vehicle, and so it's certainly recognizable. And I think that it is different than a police vehicle, of course. So I think that there is a different reaction to it, and certainly that a different kind of trust or response to that kind of vehicle. So I think there's been that, and I think there's twofold, like there's community members who might be calling the team as a third party caller. And I think that there's, because of, access to the news and things like that, there's been, and I put this in a chat, a recent news story that occurred around the team that I encourage people to take a look at if you have a moment. But I think that there's definitely community members who have come up to the team wanting to know more, wanting to introduce themselves, people who are very involved in their communities. So I think that there's both that, but then also us wanting to build relationships with individuals who might be in need of the services. And I think that will take a little bit more time to develop. And there have been people who have asked, who the team has had contact with, like, how do I call you directly? Like, if I'm in need, like, how can I get a hold of you? I think some of that will take time to develop. So I think there's both whatever we can do in terms of educating the community, working with community leaders so that they can also share the messaging and talk to individuals in their community about the program, which we're working hard, and that'll be an ongoing process. And then I think there's also just being in the community, building that trust of being responsive to the need, and that'll take a little bit more time. Simon, do you have anything you'd want to add to that?
Just reinforce what you said. Couple things. One is we see a difference. Our first 2 units are in the Tenderloin, and the second one is in the Castro Mission. When we're fully implemented, we will be citywide. But for now, we want to focus on these areas because we want to demonstrate that we can successfully handle police calls in these small geographic areas. We found that in the Castro Mission, a lot of community groups come out and say hello to us, and there's a lot more community involvement. The Tenderloin, I believe, I don't know if you've been to the Tenderloin in San Francisco recently, but there is such a crush of problem behavior that has been normalized that, it's a little bit different there. Community members and allied agencies that want to call us by name, they want us, they don't want police. They specifically either call the 911 dispatch or call us on the phone saying, we want you. And at the moment, because we're not fully implemented, it's problematic because if we have everybody calling us for their special need, then we're not available to handle the next police 911 call that we're trying to divert. So that's been a problem now, and I think it's a problem of implementation. Once we're fully implemented, which hopefully will be early summer, that problem will go away. And also, whether we're well known out there, I feel that it's a very difficult message now to get forth to the community that if you call with the specific criteria right now, someone shouting in the street, you might get us or you might get law enforcement depending on the day because we only have 2 units up. That's a difficult message. But once we're fully implemented, I think we'll be much more, ready and committed to get a very, public information campaign started to make sure that everybody knows that we're available.
I have one follow-up question. With respect to the evaluations that are being conducted, Do you have target dates? Will there be like interim evaluations, or what are the kind of target dates for those?
Yeah, I don't have the dates in front of me, but we are looking at this on a regular basis. We are going to be doing and just to mention, there's 3 data sources that we're looking at. So there's the CAD, there's a fire department log. We also have an electronic health record within the Department of Public Health. And so making sure we're aligning all that data, cleaning it, and so we're able to look at our responses, but also, again, the outcomes for individuals that we're serving. At the end of this month, we're going to take a deep dive into our data thus far, but we'll be doing that at regular intervals and hoping to be able to share that information publicly.
Fantastic, thank you.
Ask just one follow-up question to Angela's. What are the outcomes that are being evaluated?
So this certainly isn't comprehensive, but one of the primary things that we'll be looking at are do people have any reductions in contact with the jail, with the criminal justice system, with psychiatric emergency services, inpatient hospitalization, certainly in terms of linkage to ongoing services. Those will be some primary things that we're looking at. Again, certainly not comprehensive. We'll be looking at multiple variables, and that may shift over the course of the project, depending on what the need is. I will say something that is unique as well as we, of course, are trying to identify individuals as best we can. Some individuals we might not have their name for, so being able to find outcomes and link that information is a little bit complicated. The other thing I'll note again is we have some dedicated, or will be having some dedicated capacity for that linkage and follow-up. One of our goals for this project is for everyone that the Street Crisis Response Team has contact with is that we at least attempt a follow-up contact within 24 hours of that initial crisis. So we'll be tracking our ability to successfully do that.
Thank you.
Other ones would be safety, whether we can do this safely. And also, we want to understand why someone might find services. Right now, with the traditional model with police response, there's not much documentation about what the situation. And even if we can't get someone to accept what resources we have to offer, we'll at least have more robust information about the person's situation.
Great, thank you. Do any other board members have any questions or comments for our presenters? And Rob, Angelica, and Simon, anything that you'd like to add? I mean, this has really been tremendous, and we can't thank you enough, but any other information that you would like to add before we close?
Thank you for having us.
Yeah, I was just going to say thank you as well.
Great. No, thank you so much. This has been incredibly helpful and informative, and you are doing just amazing work. So it's just really impressive. So thank you.
Yes, thank you all very much for your time. We truly appreciate it.
Steve, were you going to say something? I just saw your hand go up. No. Okay. Okay. So Kendall, shall we open it up to public comment?
Yes, it is time for public comment.
Okay, terrific. Okay, so thank you again to our presenters, and we'll move to our public comment. And this will be an opportunity of anybody who has been joining us on this in our today's meeting to provide your comment. We'll have to limit it to about 3 minutes per person. And we are going to open this up geographically since we're just here virtually. And we'll start with Northern California. And Kendall, I believe that if somebody would like to speak, do they need to indicate in the chat for you to let them in, or do they just unmute?
We're in BlueJeans, or the regular BlueJeans, so we'll just ask them to unmute when it's time.
Okay, so thank you. Do we have any public comment from Northern California? Okay, not hearing any. We'll move to Central California. Any public comment from Central California? Okay, so not hearing any. We'll move to Southern California. Any public comment from members of the public in Southern California? I believe we have Mr. Hilton. Oh, maybe we don't. Okay.
Okay.
I think
Angela,
Mr.
is he?
Hilton is on.
He's talking, but we can't hear him.
Mr. Hilton, do you have a public comment? Perhaps put in a chat if you do, because we're not hearing you. And then we can see if we can fix the problem. No? If this is right? No. Okay. Mr. Hilton, are you speaking? Perhaps if you can hear me, and if you are speaking, if you want to put in the chat if whether or not you do have a public comment, and then we can see if we can alleviate the problem. Give it another moment. Okay, he does. Mr. Hilton has a public comment, but for some reason it looks like you are unmuted, but we are unable to hear you. Let me check with Kendall or Aisha if you may know of a trick to help us out here.
You know, Angela, his computer volume could be down, even though he's off mute. Okay. Yeah.
Let's try that.
I now see his video. So, Mr. Hilton, we can see your video currently. I just can't hear anything, but your video is now showing.
Mr. Hilton, maybe you could call in on the phone. There is a phone number. Anna, do you happen to have the phone number?
I do. The phone number is 408-317-9254. Meeting ID 818-781-857. I'll copy that into the chat as well.
Thank you so much.
Okay.
Oh,
Can you
great.
hear me now?
Yes, Mr. Hilton, we can hear you.
Okay, thank you. I had raised the question on chat, and the question is this data that's being collected police stop data, or is it data that exists elsewhere? And the second question relates to, if it is police data, what safeguards do we have to ensure that it has the necessary integrity that would cause us to rely upon it? I heard much talk about the well-being codes and checks. Okay, it says I was muted by the moderator. I will stop talking. Thank you.
Yeah. Thank you, Mr. Hilton. And that may be the areas that we can follow up with our presenters. My understanding, just so that for discussion of the board, is that this was separate data that's being collected and evaluated by these particular teams, but those are areas that we may want to then explore with our presenters. Are there any other comments from Southern California? No. Okay. Well, thank you. And I think next then we can open it up for the discussion by our subcommittee regarding our proposed calls for service chapter in next year's report, our 2022 report. And let me just, before we open it up for our board discussion, I would like to ask Kendall, was there anything you wanted to add with respect to the PowerPoint and the slide that you had showed us earlier when we opened up the meeting?
Just a few things to kind of kick off the subcommittee brainstorm.
Great.
I'm going to go ahead and share I've just discovered how to share my screen, and we've already been in a year of COVID, but yeah. Can everyone see my screen? It looks like we have a yes. So we talked about last year's work and kind of our visions for future reports. A few kind of brainstorm ideas coming back to bias by proxy, but also thinking about the presentations we heard today, is thinking about what we've learned about dispatch systems and coding calls in these crisis response situations that we may also be able to use in approaching bias by proxy. A few other ideas are looking and assessing dispatcher basic training and possibly beginning to review individual agency policies on calls for service. Last year, there was some mention about a pilot project on bias by proxy. We wanted to know if that's something the board is interested in exploring, and if so, what that would look like. We've started to review national bias by proxy policies to see if agencies have started to implement changes to include bias by proxy. So that's certainly something we could review. Another possibility, and these are just brainstorm ideas, possibly legislative recommendations regarding bias by proxy, and discuss possibly bias response teams and restorative justice approaches to calls for service. So similarly to street crisis response teams, having a community-based crisis response team for issues involving bias by proxy. Again, just a few brainstorm ideas for the board to think about moving forward. Similarly, just again, a few things to think about with crisis response. We discussed possibly looking into best practices and community-based crisis response. And do believe we have some great research on this that we could share with the community, both from our presentations and then also through independent research as well. We could begin to investigate model policies on bias-based policing and mental health, and then consider some lessons learned from these crisis response models we're taking a look at. In your meeting packet, we did attach the SAMHSA national guidelines for behavioral crisis care. The full report is several hundred pages, but we've just attached the executive summary. Wanted to highlight a few things for the board, though, in the best practices that maybe we want to bring into this year's report are, of course, having a regional crisis call center, mobile crisis team response, and then, of course, crisis receiving and stabilization facilities. Another area that I think is within our reach for covering in this year's report is essential principles of modern crisis response. There are some things we've kind of heard across the board of addressing recovery needs, significant role of peers in these intervention models, trauma-informed care, a zero suicide aspiration and safer care regarding that. Of course, providing safety and security for staff. And then we also heard about today incorporating harm reduction, housing first, and using those principles to create the core of crisis care as communities determine their needs and what model fits best for them. So I'm going to turn it over to the board. I'm going to stop sharing my screen and open it up to the board for discussion on how you want to move forward and your vision for this year's report.
Great. Thank you so much, Kendall. To keep us organized, perhaps should we start with one top? We'll have bias by proxy. I'm going to discuss kind of our vision or ideas about where we should be going on our work in preparation for our next year's report, and then we can move over and discuss the crisis response aspect. Does that sound, Sandra?
Mm-hmm.
Yeah? Okay.
So do you mind if I jump in on bias by proxy? Okay. You all remember over a year ago, I think it might have been the 2019, we started to talk about two senators, California state senators, who talked about these calls for service based on race or ethnicity. And what we got today was awesome, and we waited about a year and a half before we put in the mental health crisis. I don't want to forget that this started with the bias by proxy, meaning people who are minding their own business. They're either parked in a car, they're walking down the street, they're leasing an Airbnb, they're at Walmart or whatever it is. And we've seen examples of that across the country. There's one that comes to mind every time I talk about this, was at a Walmart in the middle of the pandemic. A black male was wearing a mask and the police were called. Everybody else was wearing a mask, but the police were called for the young African-American male who was also wearing a mask. And the response by the police was to escort him out of the store. And he wasn't doing anything wrong. So we just have to make sure that we don't forget that, because there are some questions that should have been asked of the caller, the reporting party, of the gentleman, the citizen, the African-American citizen who was in the Walmart wearing a mask like everybody else. Those are the kind of calls that when I travel across the country, I ask this question. Are we still going to those calls in agencies all the way from upstate New York to Southern California? And the eye rolls are still there. Officers are still being dispatched to those types of calls. And it is, when we say bias by proxy, it's also called race out of place. We are still getting calls throughout California of a person whose race doesn't fit the demographics of the community that they're in. They could be a person who has just recently moved in. They could be a person of color who is a real estate agent, or a person of color who's visiting someone, and the police are called. There have been several calls here in the state of California that we have looked at and heard about. I don't want to forget that my idea about a year and a half ago was, do we have a list of questions that dispatch can have to ask reporting parties why this person in the community is disturbing them? And is there anything suspicious? Because suspicious could be based on their bias. So just like medical calls, when a person calls and says, there's a black guy walking down my street. Okay, this is, America. What is he doing? We should have a list of questions. Do you see a weapon? Has a person engaged you? Has a person knocked on doors? Did they go in someone's backyard? Are they looking through cars? Those are the kinds of questions that we should be asking through dispatch before the officers dispatch out to the call. Because once the officers dispatch out to the call and the person wasn't doing anything illegal, that sometimes is where the problem comes, because all the officer has is suspicious behavior. And by the reporting party, it could just be he's suspicious because he doesn't fit in the community. Or I've even responded to calls, I've never seen that person before. And that can make a person feel suspicious because they've never seen them before. And so when we talk about bias by proxy, also subtitled race out of place, those are the things that I don't want to forget, because what we got today was awesome. And we should be. We thought it was going to be huge, Angela, when we started talking about the mental health a couple of years ago. This is something that we've needed in law enforcement for years. But I don't want to forget that the simple everyday thing that a person is doing, minding their own business, and the police intervene because somebody else is uncomfortable with their presence. Those kinds of calls can get law enforcement into trouble also. So I don't want to forget that.
Yeah, no, I totally agree. And I think that our reports and our work, we've done a lot in the area, but I think that, to kind of at least tie it up and to be able to now kind of go deeper and provide, we've given some kind of general recommendations based on our work, but I think now we have a year, like to do what you're saying is, actually develop some model policies, some model language, scripts, like you're saying, for the dispatchers. And then also, the ideas about restorative justice and the follow-up that we would be recommending that be done, and working with the caller, to help educate the community and individuals who are making these type of calls. So I agree. I think that we've laid the groundwork for it, but there is some work that I would like to see us do and include in the report. And my sense is that law enforcement, really would appreciate that and appreciate more information based on research or what other jurisdictions are doing, but, that are best practices that are very concrete for them to consider. That's my sense.
Yes, I would also like to discuss next year that when we have these calls, the person who is calling is sometimes labeled as a racist. And that's not always true. That person could be really living within their own fear based on an experience they had somewhere else or in the past, or something they saw on TV, or some demographics or news that they heard on Channel 2. And so when police respond to those calls, it's sometimes the officer who has to do the education. Ma'am, why did this bother you? Or, ask questions about, I heard that there were robberies on Channel 2 or Channel 11. Because I have to be honest with you, when I was working as a patrol officer, I had responded to calls similar to this, before I knew what bias was, I labeled in my mind, my bias was that person was a racist. And I learned something about that when I responded to a call of a woman who asked if I were a white Christian police officer. And I was taken aback and I said no. And so she said, I requested a white Christian officer. She slammed the door. So I left, and I was so, I made it about me. I was angry. So a couple months later, the call came out again, and I went back to that call. I actually jumped on the call because I wanted to see what was going to happen again. And it did happen again, exactly like that. But the second time I said, well, yes, I am a white Christian officer. And she put her hand out the door and she started looking for me with her hand. And I realized she was blind. And so I didn't do my job the first time because I took it personal. It's not that she was a racist. It's just that maybe that was the way from her own country, or maybe she was comfortable with that. She was an immigrant. And I spent about an hour and a half in her house. I think I put an apron on and made coffee because I was ashamed at my lack of response the first time, because I judged her by my own bias as being a racist, and she wasn't. She was a sweet little old lady. And so those are the conversations that we want to have with law enforcement, that we don't take it personal, because it's not about us, it's about them. And the topic of bias by proxy and race out of place is very important, but it falls to the police officers sometimes to do the education. And that's, we're educating a lot in uniform. So I think it's an important topic, and I would love to see that some kind of script, you said, Angela, some script that would come forth to help dispatchers determine who they're going to dispatch or how they're going to dispatch it.
Yeah. And I do realize, I think there's so much work for our second topic that we're going to need to cover. So it's a lot, but I do think that we could approach it, and still stay focused on both issues, And it may be that we'd be doing additional work down the road for, calls dealing with people in crisis. There'll be continuing work in additional reports in addition to 2022. Steve?
Yeah, it was an interesting conversation. It seems that both topics do have a common structure in some ways, that the dispatcher has to be able to discriminate between, calls where someone's bias is sort of actually being used to sort of allocate law enforcement towards a situation where they don't need to be. And in the other, dispatch has to decide whether it's going to be, a non-law enforcement team that shows up or law enforcement. And it just makes me wonder. I mean, I think scripts are important, and I think checklists can be very useful, especially if we have, some sort of hard data that says this is a call that's likely to be biased by proxy, or hard data that says this call is likely to be responded to better by our sort of non-law enforcement team versus the law enforcement team. So I think both topics are related. I wonder to what extent can we use RIPA data to perhaps identify things that are highly likely to be biased by proxy, and then think about using that information. And it might be that one needs CAD data from departments to do that, but it's just a thought.
Interesting. I wonder, along those lines and trying to figure that out, I wonder, just then I think about, you think be helpful to look at one particular, like a small agency and a set of data to try to figure out, if their stop data could inform this, or how would we best go about that, trying to figure out like what data would be most helpful on these issues in terms of stop data?
Well, I don't know that stop data. I don't know that stop data would be the point. In some agencies in California as well as across the nation, if the reporting party can't meet a certain criteria on suspiciousness to get an officer to stop, they don't go to the call. Mm-hmm. In some agencies, they put up beat data on the MDT through CAD, beat data. The person was walking down the street. I've never seen them before. Does not meet the criteria for suspicion. Therefore, we shouldn't be going to the call. There's a Hispanic guy walking down the street with a knife. Obviously, we're going to that call. It's suspicious enough and dangerous enough. But I would tell you, we have been going to these calls forever. And to speak to police officers in a classroom setting, they're frustrated with the calls that some policies say they have to go. Some policies say a supervisor can take the call, and some agencies don't have cell phones for their officers to call the reporting party to determine, why are we coming out there? How you doing, Mrs. Brown? What are we coming out there for? What have you seen? What have you heard? Okay, all right, ma'am. Well, in this neighborhood we have diversity, and the person is walking down. Those are the kind of conversations that law enforcement officers are having to have with citizens. And sometimes police go out to a call that is not suspicious, and sometimes we pull out guns and we prone people down and we handcuff them based on somebody else's idea of what's suspicious, and then we find out that, wow, we shouldn't be here, and we've scared people to death, which leads to the whole image of policing and the fear and the distrust, because those stories get told, and it gets bigger and bigger and bigger by the time it gets to where it's going, and it's sad that we can't come together. And so the bias by proxy, I've been in law enforcement since 1982, and I remember in the city of Palo Alto going to those kinds of calls, and how hurtful it is to ask a person what they're doing in a community. Basically, I'm saying to them, hi, how you doing? I'm Officer Brown. What are you doing in this community? I'm basically saying you don't belong here. So where do you live? Where are you going? And that's hurtful, especially for somebody who actually lives in the community. And so education is important. This topic of calls for service is important. The crisis part of it is very important. But we've also inadvertently throughout the country we've hurt people based on other people's calls. And in some situations, we've killed people based on someone's calls. And I think that it's a topic that we really should focus on. And Angela, I like your idea of studying calls for service in a smaller agency just to see what kinds of calls are coming so that we get a baseline. And then we can work from there to say, okay, these are the kind of calls that agencies are going to. How can we, what can we do with that information, and how can we interrupt those types of calls? Is it public service programs? Is it community meetings? When we educate the communities about calling police, it's our fault. We say, if you see something, say something, but we don't tell them what to see or how to say it, and so I will not beat this dead horse to death, but I think it's important.
But I just, and also looking at my notes from our report, so what I have here is that of all the stop data that we had, that we report, that we, commented on and reviewed for last year's report, only 5% of the time, those were calls in response to a call for service. So I suppose, we could do a little bit more work, and in our report has some breakdowns about those, but I'm wondering if there's a little more information that can be gleaned from that data, or is it the case that many of those calls for service don't actually end up in a stop, that gets reported, but yet they're problematic?
Yes.
Yeah, I don't know where that leads us. It's maybe looking at data, maybe looking at a small agency, but I don't know, how best to do more analytics on this issue.
Yeah, I wonder perhaps part of that might be that we, our data is, CHP is kind of representative of a huge proportion of the stops, and so maybe that 5% number is a little bigger, and the DOJ staff probably know better. But I do think that perhaps there's a lot of dispatch on the stop, or it's not reported for some reason that we wouldn't see. So I mean, there, another possibility might be, for a policy project to think about what law enforcement agencies across the country have tried to do to address this issue. If anybody has experimented with a script to use that dispatchers use when it comes to these questions, or maybe even doing survey of law enforcement leadership and just draw upon the kind of experience about what calls are likely to be unnecessary and what aren't, and maybe try to come to some consensus, some combination of the two, and then combine it with analysis of RIPA data to find calls for service that are obviously I don't know if we can ever find anything that where nothing happens all the time, but where it's more likely than not that it was someone basically biased by proxy call.
And, I am struck by your point that both of these issues, the dispatcher is a key person.
Yeah.
And I think often, at least members of the public don't think of the dispatcher, as having a key role, but, so focusing on any recommendations or assistance we can provide, I think could be very important.
Yeah, we got to be careful that we don't put the whole basket to dispatch. In my career, working even undercover, I've been the black guy in a car out in front of someone's house when I'm in a car undercover watching something, and it's so funny because when the first call comes out, I start looking for the black guy in the car, and then I realize that they're calling about me because I've been out in front of their home for an hour. And of course, they dispatch. I let them know nobody came by, but it happens a lot. And then something to what Steve said. CHP has most of the stop data information we have, but CHP doesn't get that many calls. We're talking community, neighborhoods, stores, parking lots that CHP doesn't have jurisdiction over. And so as the stop data starts to grow, we may very well start to see those numbers in the stop data increase as other agencies come on board, and that might take a couple of years. But I think obviously we all think it's an important subject matter because there are people that may even be on this call today that have been stopped by the police for doing something that's just ordinary, and the police had been dispatched and intervened, and it makes you angry because you're not doing anything. And so I just want people to understand that the RIPA board is very concerned about that. We are spending some time looking at it. We have not forgotten about that, and it is still an important subject for us to look at.
you. Any other board members have any comments about this topic?
I had so just one thing to add, and appreciate everything so far, both the presentation and this conversation. The thing to add in terms of the bias by proxy, I think what Chair Brown said makes sense in terms of the public education. I know we've talked about last time, like after a call, seeing if there's a way to be able to find out if the police officer followed up with that caller and educated them. I would also be interested if it's possible to find out about proactive community engagement. I feel like for non-people of color, right? For the people who are making those calls. Like a lot of time you hear about community engagement, community policing, and it's within communities of color. Are we doing, what jurisdictions are doing that education and trying to get ahead of that proxy for the people who are making those calls? So what proactive education is happening and how do we get that data? Is that happening anywhere? In addition to like the potential follow-up. But those are other ways too to potentially combat, and the data may or may not prove this, but to combat it versus just more community policing of communities that have already been policed their whole lives, right? So that's something to also think about.
Actually, that's a good idea, Felicia, because wouldn't it be nice to have best practices, a pamphlet that once we make contact with the reporting party to explain to them that there was nothing suspicious going on, that the gentleman or the young lady or the person walking, and then here is a pamphlet in case you have you feel you need to call the police. But why don't you read this now? They'll give you an idea of what was suspicious behavior, because we're not going to go to a call. We're either going to call the person or we're going to respond. But at some point the reporting party is going to get contact from the police. But it would be nice to be able, as an officer, to hand a pamphlet that I carry in my glove box in my patrol car once I go to that call and determine that, there's nothing suspicious. And by the way, how you doing? Have a good day. I talked to the gentleman. He's on his way. He hasn't done anything wrong. And here's some information from our police department on how to call, whom to call, and when to call. Because that's that education on the back end. That's a good idea, Felicia.
Great. Okay, should we move on to the calls that involve people in crisis? Talk about, ideas and work that the subcommittee would like us to be doing as a committee on that topic, with an eye toward the 2022 report. Yeah, I was just I think that we all were so impressed with today's presentation that to be including, information about that and following that, continue to follow this program, see what kind of data and evaluations, what they're learning through this program, I think would be very, very wonderful to working on and include in the report, and lessons learned from it. And could be very valuable to other jurisdictions. I'm kind of hesitant to believe that we may be ready at the end of even this year to say, well, here are the ultimate best practices without, really seeing a program like this and some of the other pilots and comparing them and seeing what kind of results they're getting, but I think that continuing to explore this and including it in the report and looking at so far what the results appear to be could be very important.
I think I'd like to see when to have during the meetings or before the meetings information on when they're rolling out their next sections. Okay, we just have 2 going now with Tenderloin and we have the mission. What's next and what's next? And so then every time they open one, if we got that information, we would know it can go into the report. And then they said that they might be open throughout the city by summer. I mean, that's amazing. That's really fast paced. Would like to see if that actually happens. And then by summer, we should be able to get some data back on the outcomes, because it sounds like he actually said police have not responded to the calls. That's amazing. And I would like to see how that works out. I'm concerned about their safety. They've got it covered. But I would like to know, how well it's working, how many calls they've gone to, how many calls were adjudicated where the person went to mental health or they were placed into a shelter, or I would also like to know who's doing the calling. Is it a concerned citizen? And I know, Angela, they said they don't respond to homes, but it could be a family member who's calling about a person who's going through a crisis that is no longer in the house, but has now walked out the front door and is 2 or 3 blocks away. I would like to know who's calling. And those are the kinds of information that we could have a report that they provide that goes into next year's report on the outcome. Because I remember talking with Cahoots, and the issue with Cahoots were they just were not this far advanced, and they were not 24 hours a day. And if I remember, I thought they were riding with Patrol. Am I mistaken in that? I thought that, no,
Well,
Sheriff?
no, I think
No, they're not riding. With. You're right on the lack of 24-hour coverage, and so it's a bit difficult for patrol personnel or people in the community to rely completely on them because they're just not available all the time. But I think we would find there's probably more of those types of programs out there than maybe some realize, and there's not a one-size-fits-all. So the model in San Francisco is very impressive, but it looks like the annual budget's north of $16 million. That's a pretty big commitment for a jurisdiction, and I don't know that you save $16 million in law enforcement services, but and it would work maybe in a city like that where it's dense. But in an area like, for example, where I'm at with 20,000 square miles of area to cover, it's a bit difficult for one car with 3 people in it to travel all over. So to scale it to the ground that you have to cover here doesn't necessarily work. But our county Department of Behavioral Health has a behavioral health clinician assigned to each one of our 17 patrol stations, and they work with the population in that specific community. For the most part, that population is known by them. They receive treatment at behavioral health on a regular basis, whether it be medication or whatever, but they're known, they're on their caseload. So patrol deputies in our case will say, John Smith we dealt with him on Graveyard, and he's causing a bit of a problem again. It looks like he's not taking his meds. Well, that behavioral health clinician will respond out there on his or her own, because they're not violent generally, and talk to John Smith and try to figure out what they can do to John Smith to keep him on his medication and get him into treatment if he wants. Because, as you know, Sandra, they don't all want help. And unless they're 5150, you can't force them into help. It's no different than the homeless population. So there's a lot of programs out there, and maybe we look at which ones are working in which jurisdictions. I've heard a lot about Cahoots, but there are some challenges with that I don't think would work here. The one in San Francisco is great, but it wouldn't work here, but it might work in a city if they have the budget to support it. So I think there's a lot of options, and I can tell you from our Department of Behavioral Health director here, we've had lots of conversations about this. She does not want to respond to 5150 calls. Her staff does not want it. They want no part of dealing with the population that's unpredictable. They'll show up later and take them from us, which they do, but they want to stay in their lane, and so they don't want to deal with that population.
Sheriff, right now, in dealing with calls where somebody's in mental distress but may be violent, or there may be, a weapon, a knife or other weapon, do the mental health clinicians ever work in tandem with the officers, or is always